The South African Human Rights Commission wants food insecurity in the Eastern Cape to be declared a disaster. The Commission says government should intervene immediately and decisively. Some of the recommendations are that the child support grant be increased from 480 Rand to 520 Rand. But let's discuss this further with the Eastern Cape head of the South African Human Rights Commission, Dr. Eileen Carter. Dr. Carter, good to have you with us this morning on the SAA morning. What is it that actually drove you to conduct this research that brought this so much to the fore that you believed it worthy of, I guess, your time and your resources?
Morning, Tammy, and morning to the viewers. Yes, in fact, this was an inquiry that we held last year in the Eastern Cape because of the prevalence of what is called severe acute malnutrition in the province. Now, that has occurred basically because the children are not getting access to enough food. So the inquiry was then held, and we called to the fore a lot of stakeholders to come and give evidence under oath. And the report that you're referring to is then the report that emanated from that inquiry. Now, in respect of the recommendations that we've made, you mentioned the number a bit earlier, but in fact, we said the child support grant must be upped to at least meet the poverty food line. And the amount currently is 510 Rand, the child support grant, but the food poverty line, unfortunately, is 760 Rand. So that would be the minimum amount that is required for us to meet the nutritional needs of children. And as you can see, there's already a big disparity in respect of those two.
One of the things that you've called for, Doctor, is for this to be declared a disaster. Where hunger is concerned and food scarcity is concerned, what would classify as a disaster? What is needed in order for it to qualify?
So the Disaster Management Act is very clear on that, and we have argued in our report and our recommendations that, in fact, the fact that we are looking at a 25% stunting rate within the province, the fact that we are looking at children dying of hunger, and that it is widespread within a lot of municipalities within the area, it might give us an opportunity to declare this as a state of disaster. But something that we need to recognize, though, Tammy, is we are not a food scarce country. We are a food secure country, and we unfortunately just looking at underspending of available funds. And something that we also looked into is we are also letting food go to waste, and food wastage in this country is quite massive. The CSIR reported at the inquiry that every year 10 million tons of food, usable food, end up in landfill sites. So what we're trying to do is we're trying to show the dichotomy between food that is in actual fact available, resources that are in actual fact available, and children dying of hunger.
So with those resources being available, and as you say, it's not really an issue of food availability per se, how does one connect the dots? How do you get the available food to the children who need it? And I guess it's also the right type of foods, because it's about the nutritional value, right?
Absolutely. So we make the comment in the report that there are two very successful programs of government: the National School Nutritional Program, as well as the Child Support Grant. Now, what we've indicated, though, and you would note, is that the National School Nutritional Program would provide a meal to children of school-going age. So that would mean it kind of excludes the 0 to 5 cohort who are not of school-going age. So what we are saying is we need to look at how we can immediately assist those younger kids by increasing the accessibility, perhaps, of the child support grant and the amount of the child support grant. But what we are also saying is we need to sit around a table, and that's one of the recommendations we've made to government, is to consider a war room on hunger in the province. And this is certainly not just a provincial issue. In the Eastern Cape, the stunting rate and the data that we had on the table indicated towards a 25% stunting rate, but nationally it's 27. So perhaps as a country, we need to come together and see how can we best address as a collective this issue. because there's a lot of people around the table that need to take hands, because the best interest of the children in terms of international prescripts, national prescripts, must remain paramount in anything that we undertake in this matter.
Earlier on, when you were talking about the impact of malnutrition on children, you mentioned stunting. But if we look at the numbers here, in 2021, 2022, more than 1,000 children were actually diagnosed with acute malnutrition. And according to the numbers here, 120 of them died. So malnutrition can be a fatal condition. But you've also said that these numbers are actually not a true reflection of how dire the situation is. Talk to us about that. Why do you make that statement?
So we've already seen preliminary data as well that the numbers are in fact increasing. And that's not only us saying that. In July, the Minister of Health also indicated that severe acute malnutrition has risen with more than 26%. So the numbers that we're reflecting in the August 2022 inquiry have surely increased. And we can only look at the media reports, and we know that the unemployment rate is also very much increasing. So that's the data that we're looking at, and that's why we're making this urgent call to government to come around a table and perhaps consider a war room, and we address this matter very, very urgently so.
You focused, I know, on the Eastern Cape, and that is your area of jurisdiction. But as the South African Human Rights Council, is this the start of perhaps other satellite projects and other satellite research that can perhaps be conducted in other parts of the country?
So the recommendations we made are very much national as well. So although we hosted this in the Eastern Cape, as I've indicated, this is a national concern. And the recommendations, we've made about 38 of them to 12 different stakeholders. This includes National Department of Education, this includes National Department of Social Development, as well as National Treasury. And we're asking them to respond to us on these urgent matters within 3 to 6 months. And then we're going to look at what their responses are and whether they are in fact coming to the table on this issue.
Before I let you go, Doctor, what are the long-term implications and the long-term impact of malnutrition when children actually get out of that childhood stage beyond the stunting?
Well, I'm not a medical professional, but the research does show that the stunting means that they are not developing at their optimal potential. That will not only have, and that's why they refer to it as a slow violence, has an impact now, but it will also have an impact in their futures. So that is why there's no time to waste on this tummy. Anything that has to do with children is a matter that has to be addressed right now.
Doctor, thank you so much for your time this morning.